Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Radius and ulna. The radius and ulna constitute as the bones of the forearm. Radius, proximal end of the radius, head, neck, radial tuberosity, shaft of the radius, borders, anterior border, interosseus border, posterior border, surfaces, anterior surfaces, posterior surface and lateral surface. Distal end of the radius, articular surfaces, carpal surface for the joint with scaphoid and lunate bones, ulnar notch for the joint with head of the ulna, non-articular surfaces, anterior, posterior and lateral. The muscles, biceps brachii, insertion, radial tuberosity, supinator, origin and insertion, proximal third of the shaft, flexor digitorum superficialis, origin, medial surface, Flexor pollicis longus, origin, medial surface, Pronator teres, insertion, lateral surface, Pronator quadratus, insertion, medial surface, abductor pollicis longus, origin, posterior surface. Ulna, proximal end of the ulna, two curved process like olecranon and the coronoid process. Two concave articular cavities like semilunar notch articulates with the trochlea of the humerus and radial notch articulates with the circumference of the head of the radius. Shaft of the ulna, borders, anterior border, posterior border and interosseus border. Surfaces, anterior surface, posterior surface and medial surface. Distal end of the ulna, head, which is articular surface that joins with the triangular articular disc and the ulnar notch of the radius. Styloid process, attachment to the ulnar collateral ligament of the wrist joint. Muscles, triceps brachii, insertion, olecranon process, anconeus, insertion, olecranon process, brachialis, insertion, coronoid process, Pronator teres, origin, coronoid process, Flexor carpi ulnaris, origin, olecranon process and posterior surface, Flexor digitorum superficialis, origin, anterior and medial surface, fractures of radius and ulna. The most common pathological alteration that directly affect the radius or the ulnar bones are fractures. Samples of these fractures include Monteggia fracture, occurs when the upper portion of the ulna fracture and is accompanied by the dislocation of the proximal radial head. Galeazzi's fracture is a fracture that directly affects the radius. It consists of a radial fracture along with the dislocation of the distal radio-ulnar joint. Thank you all. Have a nice day.